sublocation ma en mar pesa mar almost 6,306,888. Mano pesa mar project no. The contractor ntie kanyo iluongo ni Fossans Holdings Limited o Nairobi. Project ntie Umbei Obumba sublocation. And wange ni jopiny mantie kae ntie PMC makamano. Project no serumo. Wabro winjo feedback. Kendo kwa chak wangeo project mar Department mar Environment kanyo. Nyo watimo desilting mar river Lielango. Aora niunge kako se samoro se chando waka kotho chue. Embe nyo tie kanyo gi pesa maromo $1,999,520. Embe no Bumba sublocation. Nyocho time orumo. Kendo nyocho dwa konyowa pimanyo odwa turo piny odichieng mokalo chien kacha. Kwa bire Department mar Thieth. Wantie kanyo gi completion maramula dispensary, male ward. Nyocho tie kanyo gi $1,997,288. Iwacho ni en at 90% completion level. Education ntie kanyo gi completion mar ECD Maobiayo. Mantie Ombei South Village Masara. Pododhi mbele nyocho tie gi 1.199 million. Chemelil Ward. Department Mara Health and Sanitation. Nyogitio project Moroka Nyong'o dispensary. Manyo okete pesa maromo 1.5 million. And Chemelil Village, Nyangore sublocation. And Oserumo, irito mondo governor obio yawe. Under the same department, wantie maternity at Ogen Health Center. And nokete pesa maromo $1,200,000. Chemelil Village West Songo sublocation. And at 70% done. Kwa biro roads, transport and public works. Ntie project kanyo miluongo ni Chief Tado to Ebenezer Access Road. Mantie Tamu, Upper Tamu Village. Yone badly eroded. Ibro nyiswa nito stage mane maentie sani. Kede a department no wantie gi Tamu Access Road, Tamu Tamu H Access Road. Tamu Health Center Access Road. Thank you. Tamu Health Center Access Road and Tamu Village, Upper Tamu sublocation, Sanikoro in good condition. Wantie kanyo kendo Gatundu Central Access Road. Man Tamu Village, Lower Tamu, and the contract Marenyo Chobedo cancelled. Wabro ngegi wamiono bedo cancelled. Wabro wijo pachube. Godnyithindo to Tamu Access Road. Mantie Tamu Village. Iwacho kanyo ni magi modwaro culvert, odwaro drain works, and ibinyiswa ni to osechopo kanye gi requirements magi jo department on the Kone Dwaro Rekanyago. Songo dio wange access road. Mantie Tamu Village. Embi wacho nwani odwaro drainage gi culverts. Odio wange box culvert. Mantie Tamu Village, East Songo, sublocation. Beo collapse. Samo collapse no jopiny timorenade. Same department, Mashambani Access Road, Mageti under machine-based program, in Tamu Village, Godabuoro sublocation, or require drain works, or require culverts, the machine-based program team enango. Yago Access Road, Mabeti mo under machine-based, in Godabuoro sublocation, Bewa Choni Dwaro culvert, Dwaro drain works, and wabroge nigi setimango. Luala Access Road, ma no team 2018-2019 financial year, mantie Godabuoro, halfway done. Angome and halfway done. Achego onenonam access road, mantie Tamu village East Songo, requires drainage. 2020-2021 financial year, or require drainage and culverts. Onenonam Tamu access road, is under machine-based program. Upper Tamu sublocation, same, Duaro culverts. Godnyithindo box culvert, mantie Upper Tamu sublocation, erosion, washing the sides during heavy rains. Not even 2020-2021. Konyalo box culvert, 2021-2022. Manbentie Upper Tamu sublocation, Duaro backfilling. Okoi Odero access road, Tamu sublocation, Duaro drain work. The joint at T junction has its culvert drowned. Okoi Odero culverts by Itimogi machine based requires drain opening. Or proceed. Mashambani junction culvert machine based in Godabuoro, Duaro drainage opening. Extension of Kibigori water to Nubian. 1.5 million in Chemelil village. Not yet handed over for use and complete. So Abronge Yomi Pokobedo handed over for use. Water, Kwabire water environment, completion of Kibigori water project. Mais 1.5 million, not handed over for use. I believe it's complete. Desilting or desiltration of Mandizini, 1 million project in Chemelil village, handed over, completed. Cleanup of Chemelil, Kopere, Kibigori, Songo, and Tamu markets at 1 million. Magio Setieki, Magio Chiro Dembele Gitich. Construction of 4-door pit latrine at Oduo Health Center. Notimgi 999,000 in 2021. Not yet handed over for use. Completion of Tamu Health Center maternity wing under health. Matim 2019-2020 and no setieke it's operational. GTO Kode Hospital Kanyo. Education, construction of Oduo ECD, Tamu village. Usable. Is it in use? Construction of Makindu ECD, 2018-2019, requires completion. Wanyisoni Pokotieke. Construction of Onenonam ECD, Mine Tamu village, requires completion. Nisoni Pokotieke. Financial year, we need to get that correct. We need to have that instituted. Construction of 4-door pit latrine at Songo Market was not handed over, but is in use. Construction of work ECD classrooms under education 2021-2022 in Chemelil village, completed and handed over and in use. Construction of Gul ECD classroom of 2021-2022, Chemelil village, completed and handed over. Under energy, installation of floodlight at Songo Market in Tamu village, not functional because it's faulty. Again, under energy, installation of floodlight at Achego Market of 2021-2022, functional, Itiokode Chirokanyo. Achego Kojowi Omudi Access Road under Roads Department of 2022-2023, 1.5 million project, handed over for use, but requires some drain works and more culverts. Construction of Kayoga Kopere Access Road, about 3 million in Chemelil Village, West Songo sublocation. Notime 2018-2019 handed over for use, but requires some drain works, I think, because of usage. Roads and transport, construction of Chepsweta Nyang'ore Market, Nyang'ore Milk Plant Access Road, Mar 1 million, handed over for use, but requires drain works and more culverts. Kwabiro Emiwani Ward, under roads Wantigi Ka Kibogo Minyange Access Road, ma 2018-2019, no tieke, tane no kantie need morokanyo, it was worth 5 million in 2018-2019. Kibogo Minyange Access Road, no, Manoas, Amilo Miranga Access Road, 2018-2019, 2 million in Miwani West. In Miwani East, completed but needs maintenance. I believe that's why we have the road maintenance teams. Masogo Kaeli Access Road, Manotimgi 3 million in 2018-2019, no TK, but Sanodwaro maintenance. Jobless Sanda Access Road, 2019-2020, 2.5 million, no TK Todwaro maintenance. Sanda Nyakoko Bridge, no team 21-22, 5 million, at a cost of 5 million in Miwani East, Otieke, Sanodwaro maintenance. Drilling of borehole at Olasi in 2018-2019, 1.5 million in Miwani East, no Tieki. Equipping of Juakali borehole in Miwani West at a cost of 2.5 million, no Tieki. Equipping of Nyakoko Water Project, 2019-2021 at 2.5 million in Miwani East, no Tieki. Construction of Nyakoko Twin ECD classrooms and education, no team 2020-2021 at 3 million. In Miwani East, no TK. Supply of ECD desks in Moroni sub-county at a cost of 2.5 million, no TK, no Tergigo. In roads, Kasongo, Istanbul, Konyango, 2021-2022 at 6 million, no TK. In Miwani East, Nyakoko Magadi Access Road of 2020-2021 at a cost of 4 million in Miwani East was completed. Masogo Kodhiambo Nyakoko Access Road of 2020-2022 at a cost of 4 million in Miwani East, no Tieki, Itiogo. Desiltation of Minyange, that's under agriculture. Desiltation at Minyange in Kasak, Kasak Estate of 2020-2021 at a cost of 2 million, no Tieki, that's in Miwani East. Desiltation of Omuga area at a cost of 1 million, 2021-22, no Tieki. Completion, I think that is not, that project is not complete. Your health, completion of what in Miwani East? Yeah. Kasongo Staff House. Completion of Kasongo Staff House, your health, at a cost of 2 million in 2018-2019 in Miwani West. And the status is Nino Tieke, that house is in use. Completion of Kasogo Staff House, your health. Kasongo Staff House. Yeah? Kasongo, okay. It's been completed there. Now, Mano Sailing Mare, Pokobedo completed. The contractor, I think, must still be on site. And Manani and project Ma 2018-2019. Fencing and getting of Nyakoko dispensary. 2019-2020 at 1 million. Miwani East, not completed. Maraming and under trade, Maraming of Kibigori Kisoyo Market, 2019-2020, at 5 million, not completed. Maraming of Kaeli Market, 2019-2020, 1 million. Under trade again, Miwani West, Notieki. Otoche Kunya Access Road, I think that's under Roads Department, 2019-2020 at a cost of 3.6 million. Miwani West, Notieki. Desiltation of Sianyako River under Environment, 2019-2020, 3 million was completed there. Great Lakes Kisure Access Road, 2019-2020, 3.6 million, Notieki in Miwani West. Nyakoko Anglican Oyuma Access Road, 2018-2019, 3 million, Notieki. Masogo Kodhiambo Nyakoko Access Road of 2020-2021, 3 million, Notieki. Could I have a bottle of water, please? Yeah, sorry. Fencing and getting underwater of fencing, getting and lighting Nyakoko Water Project, Manotim in 2021-2022 was finished. The battery is going low. Can we get an extension cable? Are you connected? Huh? Power. Huh? It's loose, huh? Okay. All right. Again, any man of sabotage. Okay. Thank you. Thank you for that. We were at fencing, getting and lighting of Nyakoko Water Project, which was done at a cost of 250,000 in 2021-2022 and was completed. Wantiege Kokwoga Konditi Access Road under Roads Department of 21-22 financial year, 3.5 million, Notieki. Multiple curves of Kabonyo Bridge, 2021-2022, at a cost of 2 million in Miwani West was completed. Ambuso Access Road, 21-22 financial year at a cost of 2 million was completed in Miwani West. Kasongo Konyango Access Roads, 21-22, 4 million. Miwani West was completed. Construction of Miranga Dispensary Block under Health, 22-23, 3.7 million in Miwani East, 50% complete. Then one Moroni Ward, but one we proceed. We proceed. That was 2017. There were water projects done there under environment. Manera Tree Nursery was done in Koru for Tenan and was completed in 2021. Drilling of Kipchorian borehole in 2021 was done. No, was not awarded and it's stalled at a cost of 1 million. 2020-2021. Water and environment again, Jaber Water Project of 17-18 in Godinithindo, stalled. Yeah. We properly guided Gimomioneo Sirkal Teo Biroka and representatives or chief officers of the departments is to respond to these emerging issues. And so what we will do, I will invite the various chief officers as we go through this to sort of give us some background information on the status of those projects so that we can make informed conversations, having listened to why we are where we are with those projects and what necessitated what happened. So to this extent, I will start by inviting the Department of Roads, Nimondo Brian Obika. Then he can give us a brief on some of those projects that we have highlighted, and he will be followed closely by the representative from Water and Environment.
Thank you, Alois. Madam CC, County Chief of Staff, all chief officers, all county administrators, and all Moroni stakeholders. Good morning once again. For those who did not hear my name is Engineer Brian Ondiek, the Chief Officer for Department of Infrastructure, Energy, and Public Works. And before we just embark on this, I'll want just to explain an overview of the kind of programs we have within our department, especially because I see roads is advancedly mentioned in this report. One of the programs that we have currently is what we call the County Revenue Fund projects, roads projects. So these are the projects whereby we tender ile tunaleta contractor nafanya. And in Moroni sub-county for this financial year, we had a target of 8 kilometers of roads. And in 8 kilometers, that has been achieved because we have a road called Achego Kujoi Road, which is complete. We also had Kamreika Kangindo Road, which was opened. And as per the scope of work, complete. We also had Kotura Ramula Road in Ombei Ward. We also have Kawandoi Charing Road, is also in Ombei Ward. So a total of 8 kilometers. 8 kilometers of road completed for this financial year. Another program that we have is called the Machine-Based Road Construction and Improvement Program. The great county of Kisumu, through the vision of Professor Peter Nyong'o, we had a program whereby the county is using their machineries, because in the end we realized that we have a lot of kilometer of roads to do, yet the funding from the national government cannot allow us to improve all these roads with the stipulating funding that we are getting. So we embark on a program of acquiring machines, grader, excavator, and whatever, just to bridge the gap that we cannot get using other funding. For this financial year, so this is a program that started in 2020-2021 financial year. And for this financial year, we picked Moroni sub-county where we did the launching. So this program was launched in Moroni sub-county at a place called Moroni Town. We started working in Moroni Koro Ward, of which we had a target of 7.5 kilometers. And as we speak, we've achieved almost 90% of that. We've graveled Lake Basin, Kajapelo Pond Road, Pondeomolo Road has been graveled. Moroni Town Access Road. Actually, the reason why we are starting with Moroni Core was just to improve the condition, the road network within the town. And by that, we've managed to reshape almost 3 kilometers of the road within the town, and also to gravel few areas that needed graveling. And I want to tell you that Moroni Town is also having a program that maybe is domiciled in Department of Lands, the KISI program. So I think that is also going to take some part of the network within the town, as we also bridge the gap on other ones. Another road that we've also done is Kuru Omaline Road. That has also been reshaped and currently is in use. And also we are planning to complete the Nyong'o Hospital, the access to the hospital. As you are all aware, people coming from around that area, we've repaired that culvert. So after the repair, we expect to now embark on the Maraming. It's a very small stretch. After that, we've also gone to Chemelil Ward, whereby we've reshaped Chemelil Academy to Achego Road, which has been reshaped pending graveling. Another ward that we've also embarked on is also on, we have Nyong'o Mamasogo Ward, Ombei Ward, and Biwani Ward. So we have roads that we've marked that we want to do using this program. Just to mention but a few, I think I've been told that time is running out, and just to cut that one short, maybe just to mention another program that you're also implementing is called the Road Maintenance Teams. So in kazi kwa vijana, we use this program just to do quick fix. Maybe a bridge has been desilted, we take the team there just to desilt. A road maybe has been cut off, we take the team there just to do drain formation, and any other work that are manual in nature. So I think I just wanted to give you that brief so that before we embark on the issues that have come up from the report, maybe you can just project.
Well, I think, Engineer Brand, the way we want to do it, why don't we give your colleagues an opportunity to give some brief remarks?
Okay.
3, 4, 5-minute remarks from each department, okay, because we want the Moroni people to have as much time as possible, and you will be responding to issues that they will be raising.
I think that's okay.
So let's invite the chief officers to just give us some brief remarks. You've seen what we have, you've seen the report, the reports came from your departments, and then we can invite the public to speak. So let me invite here the chief officer or the representative of medical services, public health and sanitation. Briefly, and you can give us a brief overview of your plans for the current financial year.
Thank you so much. From the report you've seen up here today, most of our health facilities are completed and ready to be operationalized. We've currently advertised for the recruitment of nurses and clinical officers and other healthcare workers waiting to operationalize those facilities. But just to give a brief, Moroni County, sub-county, has about 35 health facilities, of which 4 are faith-based, 26 are government facilities, and 5 are private facilities. Facilities received fundings as late as last week. All the facilities received the NIDA fundings. These are health centers and dispensaries and the level 4 hospitals that are within this sub-county. The sub-county has 41 community units, which are all functional. Community health committees, who forms the governance of these committees, have been trained. We have the health centers and management committees. The elections were done. They are yet to be gazetted and then trained to start overseeing these facilities. Under referral services, Muhoroni sub-county, we have 2 ambulances which are coordinated centrally, and these ambulances have been providing efficient and effective referral services to the people of Muhoroni. In terms of commodities, all our facilities have commodities, thanks to the ascent of Facility Improvement Fund that was done by His Excellency. Our health facilities are now able to collect money, budget with that money, with those committees. They're able to plan for those facilities in terms of buying drugs, in terms of paying casuals, and in terms of general improvement of those facilities. Briefly, I'll touch on that as we still proceed with other programs. So if there's any concern in those particular areas, you're allowed to keep in the parking lot and you'll ask at the appropriate time. Thank you.
Thank you, Director Odiga, for that. I'll advise the chief officers to take very clear notes when the plenary opens. May I invite Trade, Tourism, Industry and Marketing representative or chief officer to come and make some remarks. Department of Trade, Tourism, Industry and Marketing.
Okay. Okay, thank you, members. I'm here we are 3 directors here representing trade. And I think under trade, what was this? Under trade, tourism, a number of things has taken place. And remember, trade was actually connected or was together with the culture and tourism. Within that framework, there are a number of things that were being done before culture was separated. For example, we had identified the tourism attraction sites, places like Luanda Magere, which we had decided to, which I think is within the Muhoroni sub-county. And a number of things has taken place. We identify the land ownership. There's a land ownership issue that they are supposed to be purchased for that activities or tourism attraction site. And it is a work in the progress. And within, actually within the tourism again, before I call the director of trade, but within the tourism again, we did a lot of activities here for fish fiestas, and it was done within the each and every sub-county, and a number of activities that are culminating into the bigger one, which was now hosted by bringing us together with the national government together. And I think that was a plus, because what we think within that fraternity is that what is it that we can promote as a signature collection or something that is outstanding within the Kisumu County. And that's why we did what is called the Fish Fiesta. When you think you go to Mombasa, people will ask you what is about Kisumu. You will be to ask about fish. So we are looking for spectacular things that we can be done or can make the Kisumu people proud, stand on its own. So that is one of the aspects that we have done. I think we have the director of trade. He'll give more highlights on the trade part of it. Just come over, please, because it is a business of collective responsibility. Let her highlight something on trade.
Okay. Hello, everyone. Okay, from the presentation that was presented, I picked on 2 issues for trade. That is maraming of Kibigori market. And I'm reliably informed that it was halfway done. And the reason as to why it was halfway done, the contractor ran out of sight. He stopped working, and in the subsequent budget, there was no allocation for that, but we look into that and see what can be done. And then same to the 4-door toilet at Songo. This was not, it has not yet been handed over, but it is still in use. We'll find out why it was never handed over. So for trade, that is all I picked, unless there is another thing. But we are working so hard to make sure that the Muhoroni sub-county gets the best. Like we have a number of things market sheds that we are planning to construct in the coming financial year. We have them in our budget for Sogo and some toilets that are there, and we are hoping to do our best. Thank you.
Thank you.
I think, Alois, just 1 minute. Allow us to, the director of alcohol is here, and I know there's work in progress here in terms of rehabilitation center. So last week he was here, so let's shed some more lights, because it is within this center which the rehabilitation center is being taking place.
Thank you. My name is Pamela from Liquor Licensing. So liquor licensing is under tourism and trade, and we do that in all the sub-counties. In Muhoroni, we are blessed to have a rehab center for the people who are affected, those who are under addiction. We now have a center here. What is remaining is about 10%, 90% is complete. We have a dormitory, administration block. We have a toilet block, a 4-door toilet block, and other things are still going on. We intend to open it to make it operationalized by August. And then once it is open, we welcome the entire community to come. You know, those who are affected at home, and maybe they don't have anywhere to go. They go to Asumbi, they go to Madare, but now in Kisumu County, we have a rehab center just here. See, that's a good job that Professor is doing. Can we appreciate Professor Nyong'o? So I just want to say that we are doing a good job. We work through subcommittees, so we have sub-county liquor committee, which is chaired by the sub-county admin officer who is here. So should you have any problem to do with the liquor, especially traditional brew and illicit brew, you know them, Simba Waragi, Empire, wherever they are in Muhoroni, you can contact us through our liquor secretary who is based in Chemelil. He's here. And thank you, Mr. Ondara. And then sub-county admin who chairs the sub-county liquor committee. They are all in 8 sub-counties. And so if there is any problem, us at the headquarters, what we do is to facilitate the sub-counties committee to work well. And I believe we are working well. We are only asking us, those who are doing business of alcohol, mulipe pesa. Kuna wale walipi revenue. Wamepereka county to court. They are saying we are charging them so many taxes. Please pay your revenue so that the county can actually plow back what you have given us. Thank you so much. God bless you.
Thank you very much. Thank you.
I think, Alois, we are around, so any other questions we'll be able to tackle when we are given a time.
Actually, plenary is coming, and the people are going to be speaking directly to you. That was just opening remarks from the department. They will be responding to emerging issues during the plenary. May I invite sports, culture, gender, and youth affairs. Sports, culture, gender, and youth affairs representative. Chief officer or the representative of the chief officer. As the department is preparing, let's have water, environment, natural resources, and climate change. water environment, give us an overview of your responsibilities and deliverables within the sub-county.
Oh, good morning again. Yeah, let me just remind you of my name. I'm James Aput. James Aput is the sub-county water officer in charge. And I think that my department has done well in terms of its programs across the 5 wards of Moroni, except for some few challenges here and there, as had been mentioned in the presentation that was given. From the presentation, I can just say that I picked on 2 water projects that we had some challenges on, and these were Jaber Water Project, that is in Moroni Ward. And this project, for sure, it stalled in 2020. It was started way back in 2016, 2017, but it went on up to 2020 when we had some challenges on the land where the water reservoir, the main water reservoir, was located. There was disagreement between the landowner and the project together with the county government, that is my department, and that is the reason why it has not been completed. I think plans are underway to ensure that it is discussion is held between the landowner where the tank was constructed, and maybe in maybe sooner or later we'll get some solutions to the problem. On the second project where I saw there was some challenge, but it's not a big one, is on Kibigori Water Project. That was done in 2021-2022 financial year at a cost of 1.5 million Kenya shillings. This project was completed. Already people are consuming water. The project is going on well. By the time the project was being done, already on the ground there was a water management committee that was there earlier before. So we have taken quite a long time without putting in a new water management committee. But I can assure you for today that we have plans. We are organizing with the ward administrator in that ward to ensure that very soon we are going to hand over officially this water project to the public, and at the same time we are going to form a new water management committee. I think for water, I only picked on those 2 projects that had some issues. So I think as we go on, we are going to answer and explain more on issues that concerns my department. Thank you.
Thank you for that opening remark. We were waiting for somebody from Sports, Culture, Gender and Youth Affairs. I know they are preparing. They are on the way coming. We'll proceed to Education, Technical Training, Innovation and Social Services. The Chief Officer or the representative of the Chief Officer. Education, Technical Training, Innovation and Social Services. As they are preparing, could we have somebody from Agriculture, Fisheries, Livestock Development and Irrigation? Yes, please come up and make your opening remarks.
Good afternoon, everyone. Still morning?
Still morning, yeah.
Okay. My name is Mr. Wilson Otieno. I'm the Sub-County Agricultural Officer. I can only speak on behalf of the Department of Agriculture. On the Department of Agriculture, we only have, for the last financial year, we distributed some leafy vegetables or local vegetable seeds, about 1,125, 25-gram packets. The other projects of the department may not necessarily be in our sub-county. That's the only one I can quote in the sub-county for the time being. Thank you.
Thank you. You said you're speaking on behalf of agriculture. Can we have Mr. Nyenda from livestock development livestock production to make a brief comment? And the veterinary team can also prepare to say something. 2 minutes.
Yes, thank you so much. Good morning, everyone. My name is Robert Anyenda, the Livestock Production Officer for Moroni Sub-County. Basically, what we've done since 2017 to 2023 as a directorate, what the government of Professor Peter does, we have distributed several animals to several farmers in all the wards in the sub-county. We have also managed to distribute checks to all the wards. That was in the financial year 2020-2021. The status of these animals are with the people, and I think we'll respond to that when they talk. Thank you.
Thank you.
Thank you so much. I'm Jambo Tena, Dr. Hilary Mondi, the sub-county vet officer. Basically, we are on to disease control for all animals within Moroni sub-county. We are available, our office is in Chemelil. We've done upgrading of animals, so hata wewe ukitaka ng'ombe yako kienyeji akue grade, we are doing that currently. We're also doing a dairy development center in Nyangore. That is where we are doing mass production of animals for selling to Kisumu residents. It's underway. We are waiting for launch. So just in a short while it will launch, and you will be able to get your animals from Moroni sub-county. Thank you.
Thank you. Thank you for that overview. I am told that the team from education is still on the way. Could we have the Department of Lands, Physical Planning and Urban Development? Yes, Madam. Karibu.
Morning. Kwa majina naitwa Martina Rita, under the Department of Lands, Housing and Physical Planning and Urban Development. We hope for a sustainable and inclusive department for a vibrant and prosperity community. The community is sustainable on its own. Under the department, we have a project called KISIP, which is done under 2 phases. Phase 1 was under tenure, where people were given titles for the lands in Moroni and under the settlements. And phase 2 is infrastructure, where we are dealing with roads, drainage, floodlights, and distribution of water. And through the settlement committees, they were able to identify specific projects within the settlement groups that are going to be implemented. Under point 2, in the department, we have development control, where we encourage residents to come and apply for approvals from the county. When you want to develop, you come and make an application for approvals. We give you your approvals we aim for a period of 3 weeks, but it depends on the time. And then we also have municipalities. Through our able governor, he just started the process of having 5 municipalities within the county. And in Moroni sub-county, we have Moroni Chemelil municipality. The process is we are in the draft stage. After the draft stage, we are going to printing, and then we are going to county assembly for conferment of municipality status. And then we have markets. We are planning to identify a few markets. We're starting with 2 markets in Moroni sub-county, where we'll identify the markets and have part development plans for the markets generated, and the people being given allotment letters for the markets. And then we also have integrated plan for Moroni town, and this will just ensure sustainable land use and urban development.
Thank you. Thank you for that overview. Now, the Department of Food Security, Agriculture is wide. It has fisheries, it has agriculture, it has livestock development, and it also has fisheries. And we did not give the fisheries team a chance to say something very briefly, 1 to 2 minutes, to give us an overview of what you do.
Good morning. I'm Kilpat Mutai, Sub-County Fisheries in charge. So in fisheries, we have a program called Aquaculture Business Development Program. What we have done, we have distributed fingerlings to 100, we have distributed over 128,000 fingerlings. And then also on feeds, we have distributed 943 bags of fish feeds. Thank you.
Thank you, Mr. Mutai, for that. Now, having listened to those brief comments, as we wait for these two departments that are still on the way, we want to give the public an opportunity to speak to us, give us feedback, ask questions. And I want to ask the departmental representatives to take very keen listening, take very clear notes, because you need to respond very constructively to the issues that are going to be raised from the plenary. Oh, sorry. A very key department has not been mentioned, because they are driving this agenda, but they also work within the sub-counties coordinating all the activities of these departments. Could we have the Chief Officer of Public Service, County Administration and Participatory Development to tell us something about what they do within the sub-counties? Chief Officer.
Thank you, Mr. Lois. You are forgetting the mother of all departments. You know, this department is the mother of all departments. Because, first of all, we are here because of this department, public service. This department is also the newest, I don't know whether that's the right English. This department is the newest of all the departments. For many years, since the instance of the county governments, the Department of Public Service and County Administration has not been here in Kisumu. So when Professor Nyong'o came in, he saw it nice to start this department. Now, just briefly, to brief you about this department, is that this department is the coordinator of the government activities, more so as a bridge between the people like you and the county government. We initiate dialogue between you and the county government. And more importantly, this is where we anchor the operations of the sub-county administration. The people you interact with every day, the ward admins, the village admins, the sub-county admins, are all under this department. So you can see how important it is. We are just less than 1 year old, but we have done a lot of things. One of them is today, what we are seeing today, what we have initiated, Huduma Mashinani. So, what do we do to the people? We send to you our administrators. As you may be aware, recently we launched the village councils. Every village, the 70 of them, will have village councils. These are the people who will run the agenda in the village. We also make sure that the people of Kisumu County have access to information. What are the things we're going to do? Public participation will be made easier, has been made easier because of this department. This is just the beginning. Now, from today, if you want to access the budget of the Kisumu County, this department will avail it to you. If you want to see our CIDP, you will get it very easily because of this department. So we are service-oriented. Yeah? So we urge you to work with us. Okay, I don't know how close you work with our ward admins and village admins. These are the people you should talk to. Their offices are within you, so go there, talk to them. Last week, I received some big guests in my office from a place called Nyong'o. I don't know whether they are here. Nyong'o people, are you here? People from Nyong'o, are you here? How many are you who are here? Only one. Because when you come to my office, I really asked you to come here today so that we can talk, because you had some issues, some challenges. Those are the things we want to hear from you. I received at least, well, there are 3 people from Nyong'o, and I quickly talked to our sub-county admin to reach out to them and address that matter. So our department basically listens to you and gets to know what you want the government to do for you. At the end of today's session, my waziri will give you her number publicly today. I'll also give you my number. The chief of staff will also give you his number, mobile phone, so that you can call anytime. But of course, we normally encourage that you go through our officers. But sometimes there are emergencies. Maybe you have looked for the sub-county, is not available. You can call the waziri and say, Waziri, this is what is affecting us in our village. So, as other departments list the projects they are doing, ours is like a bridge, coordinators who connect you with the other departments. In that department, we also have a department, a very good department called Special Programs. This directorate called Special Programs actually deals with a lot of emergencies. Like I know in this area, recently you had a lot of problems, floods, fires. In this department, we have a directorate. Mr. Richo is here. Can they see you? Just so that can they see you? This is the guy in charge of social programs, which I know you are encountering every day. When there were floods here, you are seeing me almost every day with this team. So he is in our department, dealing with special programs and disaster management. I'm sure he will also give you his number, so that in case you see something wrong, maybe you can contact him. Otherwise, generally, this department is a coordinator, enabler. We are the enablers of projects in this county, enablers of coordination. Otherwise, we shall respond more to the public when you have any question to ask us. Something I was forgetting. This department, we also have enforcement officers. I know you know them very well. You have stories to tell about them. This guy also falls under this department. People you see in the market trying to ask you to obey the law. If you are not paying revenue, they can tell you, please pay something. So they are also in this department. Otherwise, thank you so much. We shall elaborate more during the plenary.
Thank you, sir. Thank you, Chief Officer. For public service, could we have the representative of Department of Finance? Very quickly, because we want to open it up to the public.
Yes, good morning, everyone. As I said earlier, my name is Wilson Obanda, and I work in the finance department. I loved it when the chief officer mentioned that his department is the mother of all departments. I also want to proudly say that my department is the father of all departments, because all these projects that are listed here require funding, and that is where I come in. Clap for me. If you were to open any slide here, look at 1, 2, 3, 4, 5. The 5th column, where we have allocations, financial allocations. That is where I come in. And it cuts across all departments. Projects require funding. And for money to be, for the budgets to be prepared and money to be allocated, that is where we come in. Thank you.
Thank you, Mr. Wilson. But you also didn't tell them that you also raised the revenue that that is responsible for that funding. Now, we want to open it to the plenary. We will bring down the microphone to you. We want you to give us comments, raise questions, and give us ideas that you have and point to us what you think has been done or is being done and the way you think that it should be done. We want to listen to your ideas. Thank you very much. And could we have the mic go down there? Okay, I can see hands going up. This is how we're going to do it. We are going to do rounds of 5. And please be very concise with your question or comment so that we are able to make time and give as many people as possible an opportunity to speak. So we will do rounds of 5. I will give you numbers. Just raise your hands. Number 1, number 2, number 3, and number 1, 2, 3, 4, and 5. Yes, sir. Yes. 2 things. Mention your name and specify to which department your question is going to. Or you want us to give you the departments? Or you want us to do per department? No. I think no. That might limit us. Why don't we just ask the questions, but the departments will take notes. If you ask question on water, the Department of Water will take that note, and when he rises up, he will specifically respond to that issue. So we have number 1, number 2, 3, 4, and 5. Could we start, please?
Thank you very much.
Just tell us your name and the ward that you're coming from.
I'm Joseph Ondego from Moroni Koru ward. My question or concern is directly to the land physical planning and urban. Moroni was formed to be town and finally was renamed to be municipality. In Moroni, we have a town manager. Town manager is working alone. He doesn't have even a secretary, when you knock, can tell you to get in. So then, a town manager should be empowered to work within necessitated workmanship that can make town to be good. Another thing is town manager is not empowered to a level that he has his town management board. I don't know whether our town manager is reporting where, when is being to be oversight. I don't know, is running to Kisumu or Kericho or Nairobi. Then this will help us to like oversight the town whether something is going wrong. Because right now in Moroni town, choo imeja. And we don't have, I don't know whether the town manager has money to offload the town, the choo or something. Thank you.
Thank you very much. Number 2.
My name is Philemon Otieno from Moroni Koru ward. I have about 3 questions in different departments. Question number 1 to the roads department. Our roads, especially in Moroni sub-county, our roads are unique. So I need to know, why is it that all the roads in Kisumu County are called access roads? We have some commercial roads. Why are they not reclassified? Penyo namba reo is to the Department of Education. We saw there an ECD desk was supplied in Moroni sub-county. Now I'm asking, to which schools, how many schools per ward, and how many schools in total in the entire sub-county? Another question is to the water department. A number of water projects stalled in different financial years. Angomio no chak moko ka no stall. we are told in NTA issue mar land. Ang'o manomiyo issue mar land ok nyal bedo resolved mondo tiek mano koka dhi machielo. Second last question, and very important, this cut across to the Trade Department, Health, and the special program headed by Mr. Richo. One gear asbestos, Moroni main market, which we all know that was banned long time ago in Kenya. And it is something madwaro urgent attention. Osewache year in, year out. What are the plans? Because this is very urgent. Mondo roofing Moroni market cha or change to kako winjore. And now lastly, we boast ni Moroni is a backbone in terms of agriculture. To kane the person who is in charge of agriculture chung, to wacho ni onge gik madhi mbele in terms of agriculture. It means even extension services, monego beni farmers yudo oktimre. Yet we have officers monde called county government. And lastly, to Waziri and to the entire department, I am very happy, and especially to the governor, mondo create this very important ministry. Ma is going to link us with the different departments, and also to the donors and Joma support this kind of initiative, Kaka Kemet. Thank you very much, and God bless you.
Thank you for very good questions and comments, Mr. Philemon. Number 3. So we know that urban development is getting ready, roads is getting ready, water is getting ready, and agriculture.
Okay, thank you. Benedict Wasonga Onono. I come from Moroni Core Ward, and just like directed, I'll have not only comment but also questions and ideas in relation to today's session. First of all, I'll request that I be understood clearly and be given time, because I'm a person with disability, and if you rush me, I get confused a little. So I'll request for that. So number one, I appreciate the department that is concerned with the organization of this session, because it is a unique approach to things. Jaluo wacho ni piny chando ng'ama riek. Koro ang'eni kare professor and professor dien. Nikech mane ng'ama piny nyalo chando. Ero uru kamano. And then about time allocation, I think this being the first one, we also need to comment on some few observations that we've made. One is that I really appreciate the approach that has been adopted by Madam Jude of having the departmental heads moving forward to make comments on their departments other than taking us through the projects, because this is not a public participation on proposal of projects. We are here for an overview. So if we delve much on projects, we'll veer off from the objective of the session, and I really appreciate that. Only that the next time or in the next session, try to shorten the time of the officials having their time, because they are always in the office. It is us who should be heard. So we should be allocated more time than them. And also, when it comes to sessional schedule, I'd prefer that you see on how to adjust on some few things here and there, especially on the plenary side. Having raised that as a comment on this, I'll start first of all with a comment to the department. Thank you, Madam Honorable Judith, over this. And I'm going to make my comment guided by 4 objectives. One is that I'm sure that this session is here to be or ensure that there is that responsive governance and interactive session between us and the government. And also it is here to strengthen public participation and civic engagement. So, Madam, when you go back, I request this, that you need to strongly encourage volunteerism. And this should be through developing a policy or a bill that allows volunteers to earn points for every hour of service to the county. Why? Because even those people who are seated here, there is no reimbursement for them. But that do not mean that they shouldn't deliver. There should be a policy to reward them in one way or another. So this policy, and especially in terms of points, can also help in our public participation in the rest of the sessions, because one, these points can accumulate at year end, and the most deserving volunteer receive maybe annual awards. This can be in terms of like scholarships for youth. It can be in terms of maybe appliances. It can be in terms of so many other things. This is happening in Cuba, and it is really encouraging public participation because you must not pay us. We are here for our good, but we need to be motivated to participate more. So please contemplate that policy, and that is my first statement. Number two goes to the need of constituting a village council. It will help you reduce the load of complaints because through that council, we'll have to ensure that we maximize on service delivery to the provisions of County Village Administration Act as legislated in the year 2020. And three, given the vastness of our rural villages, like Moroni, Koru Fortenan, and Murondi Godnyithindo, these villages are very vast compared to villages in the town center. So mobility of the administrator sometimes becomes even a challenge. So you need to do something to ease their mobility. It could be even in terms of provision of a motorbike. Having said that, that was my preview comment on public service. Now let me target some few departments. Number one, I'll start with sports, culture, gender, arts, youth affairs. I believe this is under Madam Beatrice Hongo. So we have a challenge. We have community teams. Where I come from, they are there, including those who are in the Premier League like Moroni Youth. But we have community teams at community level. So we are requesting here in that you should model an approach of ensuring that you improve them, not only their managerial, but also entrepreneurial and technical capacities, so that they grow from where they are to some other end. This will not only build the image of the county, but also empower the youth and give them something to do. In addition to that, and in the same department, procurement of sports gears, I've seen it happening. We've benefited partially, but more needs to be done for Moroni Koru ward. And then specifically for youth, and this, please take it seriously, we need the county government to launch a business plan competition challenge, targeting youth as entrepreneurship development initiative. This will not only stimulate, but also provide inspiration and support to young individual entrepreneurs in setting up businesses. And as I've said, the competition specifically should aim at turning great ideas into thriving and sustainable businesses amongst the youth. With the competition, you'll identify them, you'll have them engaged, you'll have them involved. In each and every way, the only way of reducing crime amongst our society is engaging the youth. The only way of boosting our income per capita to reflect mainly on our GDP is to engage the youth. So let's focus specifically is need for water. For 1.5 decades, a whole town, 1.5 decades has not been without water. This is despite the fact that SWASH program, through partnership of Sana International and Emory University, had dug a borehole at Koru. And this borehole has a capacity of serving that population for 90 years in a radius of 4 kilometers. But this has not been done. They did it because there was a part they were to reach at, digging the borehole, making it available, and they did it at a public institution, that is Koru Township Primary School. And the remaining part, that is the reticulation, was to be done by either the county government or any other decentralized fund. What is needed, therefore, is installation of submersible pump and consequent installation of reservoir tank at the nearby hill that had also been offered by a resident for free. Something needed also is to establish something like maybe a vending kiosk or a reticulation system so that the community can get it. And finally, provide capacity building for the existing community because they formed a committee to manage that establishment. And therefore, something needs to be done. We proposed this under FLOCA, and I believe the line department should follow up with FLOCA and ensure that this thing is mainstreamed. On terms of education, I don't know why it's not effectively presented.
Thank you.
Yes, I'm finishing. I'm just finishing.
Yes, well, I think we have indulged you enough. Kindly, these people want to also contribute. We appreciate your very constructive contributions. Thank you very much, and I know how. I see you know how to steal time. Okay, so we're going to number 5. No, 1. That was okay. We're going to number 4. Number 4. No, that was You're 5. Yeah, let's do 4. And we're now giving 2 minutes at most. Please, be very concise.
Okay. I'm Johannes Otieno Bongo. I'm coming from Moroni Koru Ward. I'm going to ask a question under Department of Health. And under Department of Health, I'm going to ask a question concerning Moroni County Hospital. My first question, are you aware that Moroni County Hospital has got certain debts that is lagging the health facility? Secondly, are you aware that staffs have not been paid? Thirdly, what criteria are you using in selecting community health committee? Because the recent committees, it was so much politicized. Second question on issues of sports. In the last CIDP, there is a Moroni Stadium. They allocated 5 million in that stadium. And I want you to go and maybe to have a look in that stadium. Nothing much has been done. In this year, in this CIDP, they allocated 4 million. I don't know I don't know what that 4 million is going to do, and the other 5 million and another 9 million never did anything in that stadium. And
Thank you, sir, for those marvelous questions. And we close with number 5. Then we will invite the officers mentioned to respond.
Yes, good morning. It's unfortunate that it's only Moroni speaking. Now, I just wanted to say this. There's no problem. There's no problem. Understand?
Sorry. Let's manage time by being clear as to who needs to speak. If it's number 5, you will come in the next time, please.
Thank you, Mr. Agel. My name is Tom Okal. I'm from Chemelil Ward. I've got a couple of questions, only 3, maybe 4, but I'll go straight to the point. Thank you for organizing a session like this. Number 1, I saw when you're rolling out and going through the projects, when I went to Chemelil, I saw a lot of projects not completed. And the column for fund allocation is dash. What are you hiding? Why is the figure not indicated? Now, there is Luala Access Road. In the program, it's written not complete, and for sure, it's not completed. But the project began in 2018. I saw you, 2021. But it's not completed. But right now, the rain is causing damage to what you did. It's reversing the efforts. So the faster you complete it, the better. Number 2 is there's a billboard by Kisumu County, Luala ECDE. I didn't see in education anything on Luala ECDE. The billboard has been there since 2018. So far, it's only the foundation that was laid. It went dead. To this date, the children are learning in a Mabati structure with an earth floor, low. Earth floor. Children, an earth floor. And these are the county government's future leaders. Then I would like to know why. Then the other question is to the physical planning department. Just to let you know that there is a team of 3 guys on a motorbike terrorizing anybody doing a construction within my area. And they say they will come from county government. And if you not get any approval, they propose a figure for you. And if you don't pay, they carry out the contractors' equipment. And they've really fleeced majority of widows who have their sons concerning houses for them. Now, if they're from your government, honestly, because they say they're from county government, why are you doing that?
Thank you very much.
Then the last question is information to my brother. The revenue guy. There is a lot of money coming from the cess, from sugar collection, sugar factories. The other time in a meeting here at CIDP, there was nothing indicating as cess received by the county government from sugar factories. It's a lot of money, but where is it going? It is not reflected in any of your reports, and it's collected every Friday by people from Kisumu County, and it's millions of shillings.
Thank you.
Where is it going?
Thank you for that very pregnant contribution. May I invite... may I invite the representative of urban development to start. There's a comment from Mr. Ondego of Moroni Koru. Yeah, the issue of the town manager working like a lone ranger. Sorry.
I'd like to call upon the town manager himself to help answer that question, Mr. Orengo.
I think they're feeling for Mr. Orengo for working alone and being the head. Well, Mr. Orengo, come on. Mr. Orengo, where do you report?
Yes, Waziri and the team. As per the law, I should report to the, now since you have a town, I should have the town management committee, which is not there. I'm now currently reporting to the director urban, which is based in Kisumu.
Tell us about the full toilet. Do you have resources to exhaust it?
No, that has been a challenge based on resources. I think what I can propose is that we should domicile some of the resources to the town or urban areas, not Moroni alone, because we have been comparing notes. One, we find it hard. If I'm in Moroni, we have different departments. So if there's a problem within Moroni town, they don't go to the revenue, they don't go to environment, they don't go to any person. They come to my office and I don't have resources. So I think if, for example, the market, let us have resources from the market department to be domiciled in the respective urban areas so that we manage them from these respective urban areas. For example, that toilet that he is talking about, we have a very big problem. It is a private toilet, and last 2 months ago, ilikuwa imeja. So I had to travel to Kisumu. I was assisted with an invoice, which I used exhauster to remove them. But it is a private one. Okay. So we need a public one. I think the request has been communicated to the respective
Thank you. That is fairly communicated. Thank you, the team from urban.
Another one?
No, you are taking notes. Can we invite Rhodes? Rhodes, Philemon had questions here. Why are all these roads access roads? Are there commercial roads? There's also something about which other?
Yeah. Okay, thank you. Maybe just to start with Philemon question. The classification of roads is a function of national government, the Ministry of Infrastructure. And through that, there is a body called Kenya Roads Board. So Kenya Roads Board normally do what we call the road inventory condition survey and classification. So it's the Kenya Roads Board to advise the Ministry of Infrastructure just to reclassify roads. As Kisumu County, now that we are coming up with towns, Moroni Town, Aero Town, we requested, because they were here around 2020, late last year, we requested if some roads can be classified under Kora, because now we are coming up with towns. And so as county, what we can do, what is within our mandate, is just to request so that they can pick up that for consideration. I don't think that one is, if it is fairly answered. Or
Thank you, Brad. There's this question about Luala Access Road that has not been complete, I think, since 2020.
Okay, Luala Access Road is a road that was done, it was started using machine-based program. It was not contracted, so just us using our machineries. And if you can look through, there are roads that we did not complete. Either they were marramed, drainage works not done, or culverts not done. We have some in Chemelil, Okoi Road, maybe Mashambani was not completed. And the reason why I also mentioned the programs that we have what we call the road maintenance teams. So these people are able to just do drainage works, which manual drainage work, excavation. And right now, like I had mentioned before, the only road that we've moved to in Chemelil is the Chemelil Academy to Achego. So we've also mapped out all our incomplete roads that not only in Chemelil, but also in Miwani, in Nyong'o Mamasogo, for their completion. These are roads that we are doing using our own resources, using our machineries. And at the moment, we might not be having all the machineries to be in each and every sub-county. Nile kidogo kidogo, but at the end of the day, we'll have to ensure that all of them are done.
Thank you, Engineer Brian. We have a question. Do we have the team from education here? Education? Yes. Welcome the team from education. I want to give you time, one, to introduce yourself, and two, to very quickly, and to respond to this matter that was raised by Mr. Philemon about the distribution of ECD equipment in schools within Moroni sub-county. He asked, how many did you distribute to how many schools, so that they can be informed. Let's try and Hasten, please. And as she comes, let's prepare 2 questions. Let's prepare 2 questions. Extra questions or issues will be collected and presented to the desk here for processing. Please. Yes, please. We noted that ECD equipment were distributed within Moroni sub-county, I think in 2021-2022 financial year. So how many schools did you distribute to?
Thank you very much. My name is Celestine Collins, Acting Director, Technical Training and Innovation, and the officer in charge of Moroni sub-county on ECD matters. The financial year 2021-2022, that must have been a typo error because the department did not distribute chairs to Moroni sub-county. The last time we distributed chairs was sometime back before COVID. Okay? And that one is what I can remember. What else?
I think so far that's the question that has, or a comment that has been made to this department. So, yeah. There's Luala ECD that was started in 2018.
Okay.
And is still at foundation level. Since then, and your billboard is sitting there talking about Luala ECD by county government office.
Thank you very much. Luala ECD, as far as the department is concerned, is at slab level, and therefore it has to be picked from there for completion. But what happened previously was that when allocating budgets for projects, full amounts were not allocated. So you would realize that at one point, they have said completion of a project, whereby the BQ said completion was slab. So that was the money allocated to that project at that particular time. Until we allocate more money to finish the project, it is at slab level.
Waziri, I want us to take note of a very pregnant comment made by Philemon here. Why do we proceed to other projects when we have other projects incomplete since 2018? That's a question that we need to carry home, and we go and self-retrospect about this. Water. Water, there's this tall, where's from water? There's this tall project in Jaber, yes. And there's also the proposal to complete the borehole in Koru Township Primary School, which was started by a partner.
Oh, thank you so much to those who had asked those two questions. The first one was about Jaber Water Project, which I said stalled in 2020, but it was started way back in 2016. As you are aware that in every year we normally prepare budgets, and the budgets are meant for all the citizens within the county of Kisumu. Since we had this challenge of a land issue in Jaber, you are also aware that in Ward we have several village units. I think it is not fair for a certain village to suffer simply because there is another project that has a challenge in a certain village. So that is the reason why when we prepare budgets for any project that is done, we must just continue doing the rest of the projects as we work on the stalled one. So that is the reason why the Jaber Water Project has stalled for those years, and at the same time, we have several projects that have been done and successfully completed in the same wards. Like in Koru, I can give an example of Koguta Water Project that has been done in 3 phases. All were successful, and the project is operational. So I think it is very unfair to say that if a certain village has a problem, the other villages would also suffer the same fate. That is my take. The second question was on Koru Township Water Project. Indeed, this project was done by one of our partners or an NGO, as had been mentioned. But you are aware that it is the responsibility of the county government of Kisumu to work on all these water projects. So as the coordinator in the sub-county, I'm aware that we have several of them, not Koru Water Project alone. It is a borehole that was done by our partner, but it requires a submersible pump for it to give enough water to the area residents. We have compiled a list of all these projects that were done with the county and our partners to ensure that in the coming years we get enough money to do the equipping of these projects. Thank you.
Yeah, thank you. And again, as government, we are not going to be defensive, and we are going to take wholeheartedly contributions that come from the public. And this question again is very important. Why are we compiling these projects if we cannot budget for them and budget for new ones? That's a very important question. We have taken it home. Could we have somebody from, do we have people from sports? I saw Director Brian. Yes, Brian, we have a concern here that last year you provided 5 million for Moroni Stadium. Nothing was done, or they can't see the value of 5 million, and again you have provided for 4 million this financial year in the CIDP. What is the problem? What is the value of that 9 million? What do you intend to achieve? And as you comment on that, we have some contribution from Mr. Benedict here that will be in your report. I think it's important that you will take it home. It's about improving managerial capacities for local sports, for community sports associations within the region. Please handle that.
Okay, good afternoon. About Moroni Stadium, in the last financial year, we had it in our work plan, but we didn't receive it as part of the budget that was approved. So we have made another attempt this year, and we are hoping that it will be factored in the approved budget. Then, by then now you will see the result of the work. We didn't do it last year because it was not approved in the budget. It was in the work plan though.
Thank you, meaning that resources were not provided, not that there's no value for that 5 million. It wasn't provided. Thank you for the clarity.
Yeah. About empowering the the managerial.
Yes, capacities for local sports organizations.
Yes, I believe that also involves the coaches and the trainers. As a department, we had started talks with FKF, and we have started seeing results. FKF has already started rolling out trainings within Kisumu County. And I just urge the public to be a little bit patient with us as we progress in this engagement. And in this new financial year, I believe we will have some coaches trained and team managers from this sub-county. Thank you.
Thank you. As urban development was making their contribution, I think they took note of these three guys on a motorbike. I believe that they're working within the mandate of the department, and this is something that we need to get. I mean, the Waziri will get a report on, and we need to know if indeed it's harassment or they're working within the county mandate of the department. Thank you. We'll go to the next round, and in this round, I want to encourage contributions from Nyong'o Mamasogo. I noticed that the Moroni Koru team and Chemelil team were so fired up. So I want to encourage Nyong'o Mamasogo and Ombei words so that we also get to hear. We will, yeah, okay. So Ombei 1, Nyong'o Mamasogo 2, Ombei 3, sorry, 1, 2, 3, 4, 4 and 5 in the yellow t-shirt. Okay. So let's start, and please, 2 straight questions. Any third one, note it on a piece of paper, hand it over to us. 2 straight questions or comments. Thank you.
As we go that direction, maybe I needed to make some clarification. That there's a question that was raised in my department that we collect cess and we don't report.
Sorry, yes.
I think it's important that we clarify that as a county government, we are very transparent. I have my financial reports here. I will not go through them, but probably that element of cess is reported. It is broken down per sub-county. There is cess. Every sub-county.
Just give us the final figure of cess that you have collected so far.
It's broken down per sub-county, so it requires tallying.
Okay, all right.
So I also wanted to say, farmers through the sugar factories. And the sugar factories are struggling. They don't pay us every Friday, as was alluded by my brother. They pay us like when they feel they have the money. So we have arrears running in excess of millions from Muhoroni, from Chemelil, and the only factory that pays us faithfully is Kibos Sugar, monthly. Thank you.
Thank you. As we're giving the opportunity to that number one, I missed something on health. I missed a question on health and the issue of asbestos in Moroni town. Sorry? we will give you an opportunity to make that comment. We are giving you an opportunity to make that comment. Yeah. So health, tell us about Moroni very quickly. Moroni Hospital.
Thank you so much.
Yeah.
On health, there are two.
And that guy of trade, please prepare to respond to the issue of asbestos in Moroni market.
There are three issues on health. One is deaths for Moroni Hospital. Two is for staffs not paid. And three is the criteria for recruitment of, criteria for selecting the community health committees. So under Moroni debt, I think as a sub-county or as a county hospital, the debts are paid by the county government. Last week we issued an AIE for all the 7 hospitals, and I think they're in the process of paying these debts. This will be prioritized for the debts that were incurred earlier. It will be paid first. Then as time goes, we'll ensure that all the debts are cleared for the hospital. For salaries not paid, we have 2 categories of healthcare workers in Muhoroni. We have those healthcare workers, those who are employed by the national government or county government. This was an issue for almost all the departments, not only health, and the salaries were paid. For casuals working at the facility, these are healthcare workers employed by the hospital. This is the Moroni Hospital, just like any other hospital. I think the same applies to the AIE that was released last week. We'll be able to sort them out with this AIE that was issued. Criteria for selecting health committees. These are elected by the members of the committee based on certain qualifications and certain criteria. And these are well spelled out in those particular areas. And each and every time the elections are done, there's an official from the county and the sub-county with the guidelines outlining how this is done. This was done at least 2-3 months ago. We didn't hear of any complaint. The gazettement is done and we are planning to train them. So as a county, we know that there was no any complaint. If the complaint was lodged, it was supposed to be addressed at that particular time. But now the gazettement is done, and the training will be done. And I think if there's any formal complaint, they should come to our offices so that we address appropriately. Thank you.
Thank you, Director, for that. Next time, be on the lookout. If you are not comfortable with some of the proposed members, you raise the question at the appropriate time. Trade, the trade representative, what plans do we have for Moroni market with regard to asbestos that was declared illegal for use in Kenya many years ago?
Okay, thank you for that question, Mr. Otieno. The asbestos issue for Muhoroni market, main market, this was in our budget 2021-2022, and it was awarded to a contractor by the name Standard Prestige, but apparently she didn't report to work. And when that happens, when a contractor fails to report, and you know procurement process has got timelines, you find that you get to the next financial year when that was not done, and it was not budgeted for this current financial year. So we've taken note of that, and I will report it so that we have it in our budget so that we are able to do it. Thank you.
Yes, that speaks to our work plans, that if we had an undelivered work plan, do we throw it away or do we carry it forward for action? Number one. No, they already have numbers. Oh, you're number one. Not more than 2 questions or comments very quickly. And chief officers, when you hear a question on your department, please just rise up and come up here.
Okay, my full names are Solomon Ogendangar. I'm from Umbei Ward. I'm going straight to the questions. Umbei Ward, one got your water project. Yao water project kaka nobedo blown off. Nyakasani the state mare community osebedo karito mondo mi wayud pi onge pi yao nekeche the system kaka nobedo blown off no. Pok wang'eyo any state from the county government ni tang'oma inyalo tim mondo mi jowa oyud pi. Machielo en Masara. Masara water project sani watiyo gi solar. Tiyudo ni solar mwatiyo gono ne wachak wakao okang' mondo mikoro nikech solar en gi mondo wati kod power. Mane koro the contractor manene kanyo no dhi mochulo nyaka pesa ka Kenya Power mondo mi the system obi. Koro mondo mi wayode gine mondo mi koro jopiny ochak yudo yo ma mondo tigo from that system mar stima up to now is a big problem. And anyalo wacho nu nekech omiya mana 2 questions go. Ne wan Ombei waonge ywaruok watiyo maber gi office. But the problem maduong' ma wan godo e office wa nekech ukelo ni jotich machiegni mondo mi watigo office go gin open. To the challenge, the big challenge ma wayudo Ombei ni e sama wabedo piny teyudo ka gik ma waloso gigo kachopo e county government to giduogo ka gin ataro. Man is a big problem and a big challenge. Maune ofisu, our ward administrators are good people. The village administrators are good people. Sani uchako miyo waji mabeyo, mwabiru tiyo godo piny kuchocho, magin village representatives. Mau plan mondo wabwayode. To walosa system moro, maka information ochopo from your office, to that information oklokre. Kuro gini kilo problem, ne ward administrators, ne kechuwatingo papers wa, to ka report biro kaka manyote morecha, you do different things. Gigi gea kanye. Mano kende system, mar challenge maduong, mawan godo Ombei.
Thank you very much. Thank you very much, Mr. Ogembo. Yeah? Sorry? No. We have numbers. We have numbers. You thought you were or you know you are? Please. You're number 3. Number 2 is there. You will get, I think, number 4. Let's proceed very quickly. Get your number very clearly. Yeah.
Yes.
Thank you.
Thank you very much. My name is Franco Pande. Franco Pande comes from Nyong'o Masogo, but also worked in Chemelil. I want to start by commending the team for organizing this function. It is one of the best. However, I want to believe that it's a team that is involved in interaction with the people now and again. It will be interacting with the people now and again. And the aspect of public participation is part of the package. So ideally, public participation has been an issue within the whole sub-county, and I would wish that the team would be able to tell us exactly how they would be able to handle this, because even at the moment, the numbers of people who attend public participation had been shrunk to 20. So I want the team to tell us that. Then there's a project within Nyong'o Masogo. I think it's a flagship project, the biogas project. It is around somewhere Kogutu there. I can't remember having heard about it in the presentation. However, I believe contractors had been taken to the place, to the site. They had started working. I think it was a project for 2021, 2022. So that one, I want to believe we should get answers to that as residents of Nyong'o Masogo, because I believe that it was geared towards helping the entire county in terms of production of biogas. The other question that I wanted to ask is in regards to health. So within the health department, we have Nyong'o Sub-County Hospital, which is a very significant hospital as pertains to work that we do in terms of GVV and SGVV. We realized that the buildings there that were constructed under stimulus program were condemned. And now matters SGV that are supposed to be confidential are no longer confidential because they don't have spaces where they can be handled. I don't have much, but the other question that I wanted to ask is that. But this is just a rider. This is just a rider. A rider on the same is that as people working within the SGBB space, GBB space, we are being told, there's been that outcry about rescue center. And when we push the county government, they tell us that we are organizing a rescue center within Nyong'o, and the same place that we are being told is a rehab place. So we want clarity on the same. Is it a rehab or is it a rescue center? Thank you.
Thank you very much for that question.
Thank you very much. First of all, I want to congratulate the Department of Public Service for bringing this participation here. Mr. Opande has asked what I wanted to ask. I'm happy that there is a rehab facility for those who have taken substance and alcohol. I also wanted just to ask about the GBV and SGBV safe house. This one, you have said is in Nyong'o, is here. Can you please think of bringing one in Muhoroni, the safe house, the safe facility? Number two, what I wanted to ask is that this is concerning the roads. If you look at our roads when they are being graded by the contractors who have been given the work, awarded, they make the roads smaller. And you know we have tractors. Those who are now passing with their private vehicles cannot make it. You have to reverse even for 1 kilometer just to make sure that you let the tractor pass. Can we maintain the size of the roads as they were? Just give me one, because I think I'm the first lady speaking. I wanted to say this to the market. We don't have a livestock market in Muhoroni, in Muhoroni Koru ward. We give our money to our neighboring counties. Can we please have one in Muhoroni Koru ward?
Thank you. Thank you. Just remind us of your name. You didn't tell us your name.
I'm Dorothy Anyango Bonyo, HSC from Koru.
Thank you very much.
Muhoroni Koru ward.
Thank you. Madam Dorothy.
My name is Armoli Awuor Oruko, born in Muhoroni sub-county and married in Muhoroni sub-county. I represent the women of Ombei. I have so many questions, but I've been restricted to ask only 2. The rest I'll forward to the county, but the 2 burning ones, the first one, in Ombei, 10 years down the line with our devolution system, we still rent our ward admins and village admins offices. We are still paying rents. And when we were looking at the projections of the projects that the county government has done to the various wards, when we looked at the projects done in Ombei, they were only 3. So I wonder whether Ombei ward is part of Kisumu County. We had a construction of our village and ward admins offices, but they are incomplete to date. They've really stayed before they are completed. The second burning question is about rice. In Ombei, one of our cash crops is rice. And colleagues, farming rice is no joke. I've been a sugarcane farmer, and I've also been a rice farmer. Farming rice is tiresome. And whenever we harvest our rice, we are in our preparation and planting season right away. Come October, November to December will be our harvesting season. The whole of our produce is being exported, mainly to Uganda. We've been asking ourselves, don't we have a county government? Because this is our next door government. And if we have a county government, that is our Kisumu County government, can't there be a policy that rice cannot be exported to our neighboring country, leaving us with hunger? Right now, we are forced to buy rice imported from Pakistan, and we are producing very palatable, very nice rice. Could there be a policy to guard exportation of our rice so that our farmers can be boosted income-wise? The last minor question is, when are we going to have our market that was constructed in use? Because the building is there, we are still suffering under sunshine, under rainfall. When is it going to be commissioned so that we can sell from inside it? Thank you.
Which market is this?
Ombei market.
Thank you very much. Number 5, you have the microphone. You are number 1 now.
Good afternoon, everyone. I'm Tabitha Omolo from Nyong'o Mamasogo Ward. I work in Awasi. Thank you so much for having this launch, or is it Huduma Mashinani launch? It's a good one, and I'm happy to be part of it. My question, or rather comment, is that I actually want to comment on agriculture. Yes, agriculture. So on agriculture, we've had the projects that they've had on fisheries, on the leafy vegetable project, and also on the distribution of chicks. But my question is this enough to cater for the food and nutrition for Kisumu County? I want to believe this is happening because we don't have a policy for Kisumu County, because we are still using the policy that is, the national policy that is. So how I wish that we could cascade a policy that could have a true reflection of the county and its needs. For example, Nyong'o Mamasogo, where I'm coming from, we are able to produce beans. Yeah. So if we could have a policy that would promote production of leguminous crops like the beans, we could answer the question of food and nutrition at the county. And also, if we also look at we are also producing, yes, we are producing sugarcane. We are also producing, and it is majorly for cash. How about food? We find that during majorly better part of the year, we go hungry. Only on a few times we are able to produce food, especially the leafy vegetable that is being promoted by the county is only produced in a very small section of the year. How about the other sections of the year? How about if we had a policy that would promote production of other food crops, that would promote formation of circles within the county, so that we're able to produce food and we're also able to sell, so that we don't have our money going outside, because the county is still depending on food from the other counties. Let us have food from our counties. Thank you.
Thank you very much. No, not Molly. Tabitha. Tabitha is crying for policy development for food sustainability. But let's start from water. Let's start from water. We have a concern here on your water project that was blown off. I don't know which year, but it's not been functional. We have Masara water project. Then there's the issue of environment, which is also domiciled in that department, about the biogas project that was started in 2021, 2022. Okay. Yeah.
Okay, thank you for those. I'll only answer 2 questions. For water and the other one for environment, I expected my counterpart, I don't know whether she's in.
No, I've been advised who will respond to that.
Okay, thank you.
Yeah.
Now, on water, first of all, I want to thank you because I can see everybody is concerned about it. Water is life. Madam Waziri, you can also see that. And we are ready to respond. On your water project that is in Ombei, I'm aware that the solar structure was blown off by wind sometimes back. We've been working on the same, and we promise that...
when was some time back?
It is now 2nd year, 2 years. It is 2 years. We are working on it, and I think for those who are in Ombei, if you can remember, there was a time we had a meeting with my chief officer, and we promised that we are going to work on the project under FLOCA program. But it is just unfortunate that the money has not been brought, but the work is on the pipeline. We have considered the project, and we are going to work on it and bring it back to operation. The second question was on Masara Water Project, where there is a dual system. That is electricity and solar. And you can remember that electricity was done by the contractor, but the meter was not installed. We have pushed the contractor, and everything has been done. They have made payments with the KPLC. Me personally, I brought to the village administrator, Mr. Nani, are you there? Mr. Eric Dudi, village admin, North Ombei. I gave him a copy of that receipt for follow-up, because it is not our duty now to connect, but the duty remains with the KPLC people. We have been pushing on them, and the reason why I brought the receipt was that they could also push it from the other end. So I expect the system to have those two types of systems of operation, that is electricity and solar. Thank you.
Our mandate is to deliver water. If it's going to involve us bringing KPLC, we will bring KPLC, and it becomes our mandate. The next one, I think, is public service. There's a question to public, could be public service and or finance. That there's a concern that when people go for public participation, the reports that arrive to the county or from the county are different from what came from the ground. So it means that in between, as this thing is traveling, it mutates. Or there's another public participation between here and the county headquarters. Yes, please.
Yeah, thank you so much.
As you address that, also address the issue of
the number.
The housing units or the offices for administrators.
Yeah, thank you. Allow me to start with the offices for the ward admin. Wasiri, currently we have a ward admin office at Ombei, and I want to report that this is ongoing. And very soon we are going to complete the ward office for the ward administrator at Ombei ward. I think that is the truth. Two, there's a question talking about the number that has been going on, that has been reducing during the public engagement, that is during the public participation that we have. And I want to report, Wasiri, that during the corona, as a county government, we said that we must reduce the number that can be engaged at any given time. Remember, there was that problem of spacing, isn't it? Some meters in between. And that is why we thought that we had to reduce the number to 20, that is manageable, that cannot spread corona from one person to another. As time goes by, I think we are going to think about it. That number should go up, because at the ward level, it used to be 20. And we said from 20 for the ward, each village to produce 10 to attend the public engagement at any given time. But because it is a concern from the Moroni people, I think we'll have to increase the number, because that number is not a true representation of the people from that particular ward. So we are going to do something about it. About the report that is not reaching the headquarters, I want to report that we get daily reports from the offices of the sub-county, and these reports start coming from the village, from the ward, to the sub-county, then to the director. The director admin will now channel the report to different ministries, and we normally channel the report to the office of the chief officers, and they get those reports every day, and it is upon them now to act on those particular reports. So the report is not disappearing anywhere. So we get the reports. When the time reaches for them to act, each department will be able to act on those particular reports that we get from the field. Thank you.
Thank you very much. Waziri has a point to make.
Thank you. And I really appreciate the conversation, but I just want to comment on what he has said, because this happens to be my department. Now, on the issue of offices, it is something we are well aware about, especially the renting and the incomplete offices, and we are actually auditing them. So in the new financial year, we have allocated a budget. We may not do everything this coming financial year, but we'll spread them so that we don't continue renting them, and we can accommodate our administrators in a better manner. Now, the other one about information being turned around, I think that's a very serious matter, and we have noted it, because along the way, what happens, especially when you've shared your views, your insights and comments. So we have noted it and we'll follow it up. There's information that flows in. Where does it disappear? That's what we must deal with. Thank you.
Thank you, Waziri, for that concern about the mutating information to the counties. Now, as Engineer Brian is coming to talk to us about this biogas project, he should also comment about the ever-shrinking roads that we know that roads have standards. Why do we build narrow roads that people have to reverse for 1 kilometer?
Thank you, Alois. Okay, I'll start with, there's a project the Kisumu County initiated called Kisumu County Bioenergy Center. So this is a project in Nyong'o Masogo, and it was supposed to be implemented into 3 phases. Phase 1 was land acquisition, fencing, which has been done. Phase 2 was now the construction of the structure, which is still at the foundation stage. Phase 3 was now the equipping of the center with the modern technology equipment. The reason why this project was coming to Kisumu County was, in Africa, Kisumu County is the only county in Africa that is pioneering what we call 100% transition to renewable energy. So this center is it will be a training center on the modern trends, modern technologies towards renewable energy. It will also be a demonstration centers to say maybe how we can do clean cooking using modern technology jikos and any other thing. So as the department, we've, in the next financial year budget, we've allocated. So the phase 2, now the construction of the center was going to take around 52 million. So in our next year's budget, we've allocated 10 million just to push it from foundation stage up to Linton, so that we might not be having the resources to do everything at once, but we'll be doing it each and every financial year. We'll be apportioning something small just to put it up. On the issue of now roads, the standard, making a road as a standard. So we have standards for making our earth road, the gravel roads. A standard road should not be less than 9 meters. Whereby 9 meters means that is the corridor, including the drainages. And what we normally do, if you are supposed to open a road, we normally involve a surveyor who will come and do the road boundary demarcation. We've normally done that, but except few scenarios whereby you find that the provision in the map is even less than 6 meters. That's why we normally call upon the neighboring homestead on the road just to wasonge kidogo. But sometimes it's normally difficult. That is only some few scenarios. Another scenario we normally encountered is that when we are doing an emergency road, what we call funeral roads, is matanga. Matanga imekuja, we need a road there. The road is narrow, tunakuja, tunagreda, tunanini. So except those other scenarios, we normally insist on the standard design and standard measurement of a road that is supposed to be done. Thank you.
Thank you, Brian. The roads are ours. We use them. So if you are living next to a road and we need you to move to create the road better for your mobility, please join us in that journey. Health. There's an issue here with Nyong'o Sub-County Hospital. There's some condemned buildings and these GBV centers. Health. Mr. Diga. Yeah, the questions around Nyong'o and GBV.
Thank you so much. Nyong'o, the building was one of the economic stimuli projects. That's why initiated by the late President Kibaki in all the countries. We realized that the building was condemned, it had cracks. So we consulted Nairobi last week. The engineers advised us that we need to hold on. Instead of bringing the building down, it is going to be renovated. They realized that it can still work. So the team was sent last week. I think the project is supposed to take off at the beginning of July after this budget. Thank you.
Thank you, Mr. Diga. There was the issue of the GBV centers that we need clarity on. Did you get that question as well? There's some confusion about the GBV centers and rehabilitation centers, rescue centers.
Thank you so much. The question was, we are using currently that condemned building for gender-based violence as a clinic. I think that's the question, or I didn't get it right. Come again, please.
Okay. I think the question would be handled by gender. I understand it. It will be handled by gender. What they are asking for goes to the gender and Moroni. Yeah. Okay.
Thank you. Let me just respond to that.
Yeah.
Thank you so much. A rescue center should cover a catchment area. And you realize that Nyong'o catchment area has more than one hospital. We have Chemel GOK up there. So it may not be necessarily constructed within Nyong'o as a facility, but we are looking at a place that is within reach of most of the people living within Nyong'o catchment population.
Thank you. The team from Gender Department.
Thank you very much. I'm George Orude. The question has been raised on issues of rescue centers. And it has been an issue in Kisumu County that, as Dr. has mentioned, that rescue center should be at a centralized position. But for a long time, we have struggled to establish a rescue center or a safe house in Kisumu. But for you to construct a safe house, the design and standards goes up to 100 million, which will be also a flagship project. We started one in Kisumu West around Tiangre, which can be a referral center for those people who are affected, but still under construction. For Kisumu, for Moroni, I think we need, we are discussing with the health department that we develop recovery units within our health facilities, and in case of any safe space, you refer to the main one in Kisumu. But we feel that we need to have one in this direction, and I saw it during our public participation, you mentioned that. So as we plan to allocate resources, I think we also need to plan to look for the grounds and facility which you need to construct this. We had a challenge of having isolated safe house because it needs a lot of operationalization aspect and also other facilities, because for you to operate a safe house, then you need interdepartmental connectivity. There is a difference between a safe house, a rescue center, and a recovery unit. So most recovery units can be there in our health facilities. They can also rescue briefly, but a safe house needs to be isolated away from everybody, because we are now saving life during that process. So I believe going forward in our next financial, we need to discuss a rescue center in Moroni and a safe house in Moroni, as we use our health facility to give us a recovery unit. Thank you very much. And
thank you, Mr. Orude, for that. Agriculture, do you have a policy that guards rice evacuation to neighboring countries or other spaces? And there's this proposal of developing policy to promote other cash crops. Do we have that in place?
Okay. Sorry, for agriculture, trade is, we have some policies that govern trade. Like for example, a trader from Uganda who has come to Kenya legally is the same as a trader from Kenya who has gone to trade in Uganda legally. So what the rice farmers can do, what we're encouraging as the agriculture sector, is to encourage the farmers to form cooperative societies where they can have competitive prices, because the farmer will go where the price is good. So we're encouraging the farmers to form cooperative societies which are going to assist them market their rice alone. Currently, we are partnering with Equity Bank, and they are as she's coming to handle that, we can prepare for the next round of 5. And I want to ask the people from the back, because we have not had voices from the back. So we will be starting from the back, coming this way.
Okay. Okay, there are 2 questions for trade. Actually, one is not a question, but a suggestion. Actually, it is in order for for us to have a livestock market at Muhoroni Koru Ward, and I'll take that report back to the office and we'll look into it. The other question was about Ombei Market. Why is it that it has not been commissioned? And as trade, we didn't take part in the construction of Ombei Market. It was done by NGAF, that is National Government Affirmative Action Fund. And the commissioning is to be done by the Office of Women Rep. And we can only come in as trade when we are invited to oversee. So we will remind the Office of the Women Rep to ensure that that is done so that the market can be in operation. Thank you.
Trade, again, is a devolved responsibility, and so it is our mandate and responsibility to follow up with any partner who delivers a project to ensure that it's usable if it's complete. So as a government, we'll move with speed to contact that office to ensure the market. You'll be number 5. Yeah. Okay. I will start. Please. It's setting what they distribute. Number 1. Number 2. No, you're a government employee. Yes. No. You should be responding to these questions. 1, 2, Tambiro, 2, 3, 4, and 5. Please, we still have time. We can only take 5 and we still have time. No, I want you to... Okay. Please, we still have time. Huh? You're getting tired. You will close. Take number 5 and then let's not fight. Because it is your function. Yeah. I wish that we could have everybody speaking. But even then, only one person can speak at a time. Only one person at a time. So everybody might want to talk, but we know that we're doing 5, 5, 5. So can we begin? Let's begin, please. Number 1.
My name is Charles Owino from Chamber of Commerce. I have only 2 questions. One is on trade. One question is on trade because agriculture is devolved and trade. So we are talking about how is the Kisumu County government going to help on the government policy on traders that are within the Kisumu County on the policy. One, we have farmers who are doing business. These farmers, some of them are millers. We have Muhoroni, we have Chemelil, and we have Kibos. They are registered millers. But we find in Kisumu counties, we have millers who are not millers. You go to Ketia's supermarket, then you find they are also rebranding their brands. How is Kisumu County going to help the farmers on the branding of these importers who are importing sugars when we have excess in our country? Second is about public participation. Director Ger, I thank you for what you do now. Some of us in the wards that we come from, we say some of the projects and they don't reach Kisumu County. Like for example, Chemelil Ward. We have a slaughterhouse project that is running for 3 million.
That matter has been raised and we've taken it up seriously. Let's proceed to number 2.
Thank you.
Okay, thank you for giving me this opportunity. My name is called Luke Ombok, Ward Manager Chemelil. I just have a few questions to ask. My question is going to be connected because probably I can see that it can get involved into the health and environment. My question is, across Tamu Chemelil Ward, we are really lacking latrines. Because if you move across the ward, you will find that the latrines are in pathetic conditions, of which in pathetic condition, the latrines are in pathetic conditions. That one is across the Chemelil Tamu ward. Because most of the people, most of the traders, they just go and assist themselves in the sugarcane plantation. Which means that already we are going to be a victim of cholera and any other diseases. So I request the department at least to take a stern action to make sure that the traders can have a good place to go and release. And then the last one is going to be under education. My question is, in Chemelil Town Ward, we have got another village polytechnic known as Yago. It was started sometime in 2007, and up to date, there is nothing that has done ever since the promulgations of the Constitution. So I'm asking the concerned department that what steps are they going to take to ensure that the project is started? Thank you.
Thank you. You can also be telling us what you're doing as the MCA's office in liaising with the administration in addressing some of those.
Thank you so much. My name is Cyprus Omolo.
Please, let's concentrate.
I come from Chemelil Ward. I only have 2 questions. One, there is this Makindu ECD Center. Makindu ECD Center has stalled for many years. We are going to start building again if you are not careful, because it has really stayed. It is bushy and left. I don't know what government is thinking about it. Second, Oduo health facility, Oduo dispensary. Oduo has also stalled. There was a time there were no toilets. The toilets were built. Now, I don't know whether it's going to work or not, because all the reports from Lower Tamu CU are being reported in Nyong'o. So let our reports be in Chemelil by opening this facility. I don't know when. Thank you.
Thank you very much. Education I've had. And number 4.
Thank you very much, Mr. Ger. I'm Nicholas Juma from Masogonyangoma Ward. I have only 2 questions. Number 1, for the special program. There were some water pans which were marked. They were earmarked to be done. That is Kambudwe in Masogonyangoma. There is another one called Kamarawa. There is another one called Kuchieng, and another one called Kogada. These were to be done by the special program. Up to now, nothing has happened. Number 2, in the financial year, it was 2020-2021. Luanda Magere, as an prehistoric site, was given some amount of money. Up to now, nothing has been done. Lastly, the project management committee. Okay, thank you. Thank you.
Ani lunga ni Patrick. Ilunga ni Patrick Ochola. Umbei Ward. Angi questions Rio Kende. Mokwongo and about health. One Tiego Bumba Health Center. Obumba Health Center ni nobody contacted or 2018 Kanegero maternity kanyo. And that maternity since now pokubedo completed. Okwange Nyong'o timore nikech sane yudo kata wanga yo ma wagologo ji kadhe nyuol e other areas waonge go. Koro ne wadoni wangeni to problem ni kanyi mombi utamore rumu. Another question machielo mane ango yao ECD. Yao ECD beno chakore 2018. No, not yet. Yeah, not yet. Koro a penjo nito yao ECD ni problem ni kanyi nikech there is a time when wabiri public participation kama ne wajudo ni omiye 500 kinyo chako miye 500 to kuma pesa gidhiye gino chung kaka no chung no. Koro wapenjo ni what is wrong? Eru kamano.
Thank you, Patrick. Charles has spoken to some issues on trade. And these are about policy. What policy do we have about rebranding of products that disenfranchise our producers, our farmers? That you go to supermarkets and you find markets have branded rice. Where do they get them from? So trade, as you come, also tell us about these toilets. I mean, the markets around Miwani don't have toilets or dilapidated toilets. Trade. Education, prepare yourself to respond to this issue of ECD centers at Makindu, Oduo, Yao.
It's okay. For about rebranding, when it comes to sugar, I think it falls under weights and measures, under Trade Description Act and anti-counterfeit agencies. So we'll look into it. I may not have an answer for that now, but it's something that we are talking about as weights and measures. That's also a department that I also head. And there's something going on, a work in progress. For the markets,
We have the markets in Miwani ward are dilapidated or no markets at all. People are relieving themselves in cane farms.
okay, that is noted.
All right. We have this matter with the ECD centers, and yeah, my sister is here. Please. Makindu ECD, Oduo ECD, and Yao ECD. What is this?
Thank you very much. In the whole of Muhoroni sub-county, I have a list of 21 incomplete projects. So if you know that you have an ECD center around you that is not complete, I have a list here, it is 21. And the department is planning to complete all the projects going forward. We had written a cabinet memo that going forward, all the stalled projects be completed instead of starting new ones. So Waziri, we are also requesting for your help to help us push the agenda that going forward, we only concentrate on completing whatever had been started a long time ago, rather than starting a completely new one. Somebody talked about Yago, Youth Polytechnic. As far as I am concerned, personally, it was started by CDF, but was never completed. The only thing that maybe was not done is that the process of transition or maybe handing over the project to the county government. So I would urge the community, if you are here, take the initiative, come to the office so that the processes are done. It is the people who push for these things. I remember in Masogowaware, a community from that region came to the office and we started something. So I'm expecting you in the office. When you come, we will do it.
Thank you. Thank you. There's this issue with the water ponds that were to be handled by special programs. And as it comes to respond to that, I want us to ask ourselves, anti-counterfeit agency, is it a county function? Yeah, so then we will relate with the national government because the law allows us to relate and address some of those emerging concerns with the responsibilities of the national government. Please proceed.
Okay, thank you. Concerning the water pans mentioned, you did not indicate the financial year. But we normally do these projects with the Department of Environment, Water Environment, and then Agriculture. We are going to follow up, but tell us which financial year were they supposed to be done?
You finished? Yes. Okay, we'll get that report. Now, tourism, you started telling us in your opening remarks about Luanda Magere tourism site, and it has come up as a concern. Can you just clarify it again? That there were some allocations?
Okay, thank you very much. I talk about development of tourism attraction sites. As you know, tourism is very comprehensive. Tourism wholesomely, there's accommodation, there's accreditation, there's facilities and whatever. But in terms of development of tourism attraction sites, which Luanda Magere is in this specific case, within the context of the situation. The issue is, initially tourism and culture were together, and I was in that department. So what happened, we put some money to develop the Luanda Magere tourism as a tourism attraction site. But what happened, the community insisted that there's no development that can take place there until we buy the land. And we didn't have money to buy the land. We had the money to develop the site. So as we are talking now, it is still, now I think it will be handled by the Ministry of Lands, the Department of Lands to handle, because we didn't have a budget to purchase the land. That is the true naked situation. Thank you.
Thank you. We were consulting a little bit. We had a number 3 who somehow was jumped because of the interests of the fair gender. Gender is both, but there's fair gender. So we'll give it to you first, and then...
Thank you, Joe.
Use this.
Thank you. My name's Jerim Odada from Moroni and the chairman of BOM Moroni County Hospital Finance. I'm not complaining, but I'm complimenting the county government for all what is being done. My concerns are few, and I need you to take note. First of all, as the chairman of the BOM of Moroni County, the governor, in his good name, came to us and promised us a mortuary at the hospital in 2018. This one was a good idea, and it was his flagship project. This thing has not matured up to now, and we stand to lose revenue because mortuaries normally generate money. When the hospitals store the bodies, the owners or the what pay money. So the county stand to lose money to other private mortuaries. So this one is a reminder and a very humble one. 2, when Dr. Gadi, the former CEO in the Ministry of Health, he promised us X-ray. We went to him, we talked, and we agreed that the X-ray will be provided. This is 2022. Up to now, the X-ray has not been delivered, but I understand it is there, but the issue is identification of the room at the hospital. It remains a problem. This also is making us lose money because X-rays, the accidents which happen along that route, we take X-ray to Kericho, and the county is losing a lot of revenue. This one, I'm appealing to, you take note, yes, that we need these 2 things appropriately.
Thank you.
And another thing, bypassing the road which was to be done from Moroni town to the hospital stalled. And it is pathetic. Sick people die in the ambulance because of the poor road. So, Your Excellency, can you take that note? With humility.
We've taken note of that.
Yeah.
We've taken note of that.
Yeah.
And Roads Department will respond.
Yeah. An Bernard Okoth awuok Masogo Nyang'oma e Ogudu village. An gi penjo ariyo to chuthone gin adek to gin machuok kabisa. Kaluwore kod education. E Ogudu primary jonyuol notemo mogero ne nyithindo classroom mag ECD. E dakika mawuoyene mineme chamo nyithindo e classes mane jonyuol emogero. Wakwayo county government mar Kisumu. Ang'o ma de utimnwa? Nikech kata kawuono jopuonj makanyo luongo nyithindo mondo kochopo chieng' tich adek gidhi gimuon e classes go nikech mineme gimoro matin miluongo ni kikuncha kayogi. Ang'o ma diang' do utimnwa? To jonyuol osetemo mogero classes. Korka health. Ei Masogo sub-county hospital kata health centers duto mantiere e sub-county ma Muhoroni. Rang'iny ne mutiyo godo mondo mi jodak mantie alwora go mondo onwang' yath manyalo konyogi. Ang'o miya wacho kamano? Ei Masogo kidhi mondo mi othiedhi, ibiro ndikni otas to kochopo kare to yath no mondo mi yudi onge. To ka dipo ni yude tichaji e nengo matek moloyo makata ni dhi e chemist. Yore mage ma utiyogo mondo mi community makanyo mondo mi onwang' thieth makare. Penjo na mogik na wacho na gin machuok. Korka roads. Wan gi barabara mowuok Oguodo kadhi Minyange primary school. County government notemo mochwere e sama ne ji dhi e nomination. Wan gi nyithindo ma kono kabire school mar Oguodo. Ndara no rach maka wuono nyithindo matindo ka wuotho to moko bende koro tamore dhi school. Yo mane ma ukonyowa godo e yo mondo mi nyithindo ochop maber ka dhi school. Ewi mago te Nyasach kwe ogwedhe na u.
Thank you for those questions and comments. The next speaker.
Thank you very much. Just two first ones, then a question. One, we need agricultural extension officers because cows have been distributed, but they have died because of extension services lacking. So that instead of just distributing the seeds, my friend can see how the farmers have planted and are managing the crop. Two, as we build roads, we sometimes are forced to put culverts. But those culverts end up being what you call bumps. So I want to ask the roads person, they are good engineers. Why should a culvert be built so that it creates a bump, an unnecessary bump? Three, my main area of concern is there is the Ministry of Technical Training and what that, isn't it? Education, technical training. But in the report we have seen today, nothing is mentioned about technical training, which means that from 2017 to date, the county government of Kisumu has not done anything on technical training institutions. They have not staffed them. In 2018, interviews were done for staffing, people were not employed. Last year, interviews were done for staffing, people were not employed. I'm sure the interviews, money must have been used to take care of the panel, so the money was wasted. So I would like the county government to take vocational training as a necessity, to staff them, to equip them. Thank you.
As we close.
And lastly, Koru town, we need planning. The town is growing a lot in terms of population. We need town planning. Thank you.
Town planning for Koru. I want to give an opportunity to one of us from Moroni Sugar Company, Mr. George. He has just come from a meeting in the neighboring county on the same issue that has been raised here about CES. George, can you please say something.
Thank
and
you.
After George speaks, then we will have the departmental heads respond to these questions.
My name is George William Sonyango. I work with Moroni Sugar Company under Corporate Affairs Division. Now, the cess matter is a big concern for the farmers, and in the last 2 months, we had a meeting with the county government of Nandi. The meeting happened to have been chaired by the governor himself, Governor Sang. All the sugar industries that operate within Nandi, Kisumu, and Kericho County were present. And the agreement that the companies had in that meeting is that we need to bring back the old committees that were formed. The committees used to work well for the farmers and the industries in terms of identifying which road requires which attention and at what time, against what budget. Now, the challenge that we have is that all the monies of Kisumu County go to one basket. Now, returning it from that particular basket to a particular road may be difficult, but that road needs to be worked on for that cane that passed it to be regenerated again. So my proposal on this, because it's working already in Nandi County, let us, as a county government of Kisumu, go back to that old committees. Bring these industries together, bring the farmers in their societies together. Let us form a committee. Say if it is Moroni region, let us say which road requires which attention, because the farmers and the millers know that. Thank you.
Thank you very much, George, for that comment. It's noted, and it will go into this report. May I invite a representative from Health, Mr. Diga. There's this question of the X-ray that the governor committed for Moroni Sub-County Hospital.
Thank you so much. For Health, there are quite a number of questions, concerns, about 3 or 4. Yeah. One is on Obumba Health Center, which was constructed in 2018. The facility was completed, and then we initiated the construction of maternity wing, which is also complete. I said here in the morning that we had to operationalize some few facilities that were complete as per the project you saw up here. Obumba is one of them. We have budgeted for the equipment, and we've advertised for staff. So you cannot operationalize a facility, a maternity or a dispensary without a staff. So staffs are recruitment will be going on, and we'll be able to send 1 or 2 nurses to that facility so that it can start operating. The other issues on dual dispensary, still the same. It's complete. We've budgeted for the equipment this financial year, and we'll send 1 staff, 1 nursing officer there so that it's operationalized in the next financial year. The other one was on X-ray machine for Muhoroni. The machine is already procured.
Our technical officers, because at the end of the day,